There's nothing better than a good night's sleep, but for other people that snore a lot, the story could be different. People that snore don't feel it as a problem themselves, but others, like family members, begin to complain. It can be a sign of serious underlying anatomical or medical issues. In this discussion, we'll talk about what snoring is, what causes snoring, the risk factors, and also the medical options that are there for people that are snoring, and how they can actually prevent snoring itself. So join me in this segment. My name is Ascents Siabukube. I'll meet you on the other side just after the break. Welcome back. Let's continue. And as I promised you, today we want to talk about snoring. So snoring is one of the classes of what we call sleep disordered breathing, or SDB. So it's one of the commonest problems that we discover even in society, though most people don't consider it a big issue. But studies actually have shown that snoring is a leading cause of relationship breakdowns. Now, let's get into the discussion. What is snoring? Snoring is a rough, fluttering noise. So it's made when somebody is trying to breathe in, produced by the vibration of the soft palate. So the soft palate is this organ here. The soft palate, which is the roof of the mouth, which is this. And then we have also the uvula. Usually they will fall back. When they fall back, as the air will be trying to pass, then they will cause vibration of these things. And that vibration is what usually cause the snoring. So this snoring will occur either in three of these areas. The first one is that there will be collapse of the mouth structures. So the collapse of the mouth structures that we're talking about is either this tongue or this uvula or the soft palate. What would cause the collapse? It could be either somebody has taken alcohol or sedatives or tranquilizers. It could be either somebody has a weakness in the nerve which controls the tongue and the other tissues in the mouth, which is known as the glossopharyngeal nerve. So any of these could cause weakness. It could be also old age. As people are aging, the muscles begin to get weak. We know that in the mouth and the upper respiratory airway, there are no bones. So structures are held together by muscles. So as somebody is beginning to age, these muscles begin to lose their strength, and somebody begins to have instances where the back of the tongue is falling down and closing the airway, and that would lead to snoring. Or it could be a blockage. So this blockage could happen either when snoring gets to serious conditions such as obstructive sleep apnea, known as OSA. So this is quite a serious condition that would result where there is complete obstruction of the air passage. So that would happen if this tongue falls completely covering the airway, or the soft palate also falls completely covering the airway. The other one is restriction to the upper airway. So this restriction happens when either there's maybe large tonsils growing, or there could be some tumors that are growing in the airway. So these tumors or tonsils would actually obstruct the passage of air into the lungs, and this would cause the snoring area. The anatomy of snoring: in a normal human being, air would pass through the nose and there would be no any sounds produced or snoring produced. But in a person who is snoring, what you are going to see is that the tongue would fall back, and this long soft palate would actually close, also obstructing this passage of air. And because there is that force, a person will try by all means to force the air into the lungs. The action of the friction between the air and this tissue would cause that vibration. So this vibration would actually produce a sound that we are later calling snoring. Yes, so there are simply three types of snoring or classification. What are the risk factors or the causes in short? So age, number one. Old age is a risk factor for snoring. As I mentioned earlier, that there are no bones in the mouth. So the structures that control the tissues are simply muscles. So these muscles may get old, and as they get old, the tissues may start to fall back and getting weaker.
Yeah.
So in a normal individual who is asleep, this is how the upper respiratory airway appears with no form of abnormalities. Sometimes the snoring can be caused by a long ovula, and this is usually what happens. Beyond the ovula, the tongue itself or the back of the tongue can cause obstruction, as you can see. When the tongue falls in the direction of the red arrow, it falls and covers the air, causing obstruction. Sometimes the source of the snore can come from the voice box. So in the previous clip you saw how these vocal cords are coming together to vibrate as air is trapped. Moving forward, ladies and gentlemen, why would somebody try to seek help because of snoring? I already mentioned one of the most common problems are social problems. It could be either the bed partner or the people in the house. When this person goes into sleep, they snore too much such that it disturbs the other individuals that are either sleeping with them or family members in the other rooms. Other notable problems, ladies and gentlemen, include noise itself, daytime sleepiness, especially in people with severe forms like obstructive sleep apnea. And there's also a risk of habitual snorers getting into what is known as obstructive sleep apnea. So this is study, researchers from the University of Warwick reviewed that people with obstructive sleep apnea, they are at more times, 3 times more likely to die of coronavirus compared to other normal individuals. What are the management options, treatment options that are there? So there's non-medical, which is simply lifestyle modification. There's medical management, and then there's surgery if all other means fail, of course. So the lifestyle modifications is basically lose weight. So when you lose weight, especially around the neck area, we know that because of that increased fat in the neck area, it would cause obstruction or narrowing of the air passage. So as you lose weight, that would reduce the amount of fat in the neck, and that would help to improve the symptoms. Stay away from alcohol and smoking. These things have a lot of impacts on your health. Other lifestyle modifications include continuous positive airway pressure. This is simply a machine which is put on the nose and the face to help maintain pressure of the airway such that there is no snoring that is seen. I will show you in the other slides. Sleeping on the sides has shown to help people. Not sleeping on the supine position but on the sides has shown to help. And then we have the nasal strips. So these are just put on the nose to help maintain the airway. So this is an example of a continuous positive airway pressure, which is simply applied on the nose. And what it does is that there's a steady stream of air which it releases. That air maintains an open airway, so that as you are sleeping at night, of course you need to get used to the machine, so that as you are sleeping at night, the airway is kept open all the time. These are the nasal strips, an example of a nasal strip which you just put on the nose to help maintain the air passage, and reduce snoring. The medical options that are there, they are not there to treat the snoring. I want to mention this. They're just there to help, probably if this patient or person has an underlying medical condition. So these drugs would help to address the disease so that the snoring symptoms can be reduced. Surgery involves either removing the uvula that structure at the back of the mouth, which may be causing obstruction, or it could be this is known as the UPPP, so which is Uvulopalatopharyngoplasty, so removal of the large and long uvula. So this is an example of Uvulopalatopharyngoplasty. So this part of the mouth is cut and some tonsils removed also. So this is an addition of tonsillectomy. So you see that there is more room for air to pass. The conclusion of the matter is that even though snoring is considered normal, sometimes it is an indication for other serious problems. So let's seek medical help, especially if you have a partner that is snoring. Help them, especially on the lifestyle modifications, sleeping positions, don't touch alcohol, and also lose as much weight, excess weight as possible, to help improve the symptoms. There are other risks accustomed to snoring, such as cerebrovascular disease, neurobehavioral symptoms, and potential risk of increased mortality. All these can be uncontrolled outcomes of snoring, and therefore it shouldn't be ignored. Thank you so much for your time. God bless.